Nagaland Health Protection Society, Department of Health and Family Welfare Bra, Aji Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, Aro Cmhis Health Insurance Scheme Upper one-day media sensitization program organized Krusha. Program do Capital Convention Center, Kohima Bralusha, Aro program de Ab-Pmjay, Aro Cmhis laga maksat, Aro Faida Upper, Kotakurasat. Media laga public awareness, accurate report, responsibility, aro feedback role upermi kotakurishe. NHPS Chief Executive Officer Tavasilan K. Ra Chanta Nimide Health Scheme laga faida chanai kina kushegi scheme laga awareness aro chankari belawledo media gan important role loi. Ito inahoi kina misconception ti kuribole aro scheme access kuribole motot kure kuigna chanaishe. Aji laga program di Twitter health scheme laga maksat faida aro media laga role upper kota kura eklan hoi gina open discussion bilushe. Details saisabo.
The purpose of today's meeting is to deepen our collective understanding of the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana and the Chief Minister's Health Insurance Scheme. So the Nagaland Health Protection Society essentially runs these two schemes. The Ab-Pmjay, as you're aware, is a central scheme. The state also contributes a part of the premium that goes into implementing the scheme. The Chief Minister Health Insurance Scheme, like you're aware, is one of the only two state initiatives that our state has launched, the other being the same microfinance. The Chief Minister's Health Insurance Scheme was launched in October 2022. Now, what we'll be taking you today is what are the objectives of these schemes, how do they operate, what are the implementation processes, and what are the challenges that are being encountered in the implementation of the scheme on a daily basis. Not just from the Nagaland Health Protection Society's point of view, but from the hospital side, but in the insurance side, and what are the issues that are most importantly a beneficiary's face on a daily basis.
As we all know, PMJY, Ab-Pmjay, it was launched by the Honorable Minister of India, Prime Minister Narendra Modi, on 23rd of September 2018 in Ranchi. And after 4 years, in October 2022, Cmhis was launched for the state of Nagaland. And Cmhis is a flagship initiative towards universal health coverage in Nagaland, and it is implemented in convergence with Ayushman Bharat PMJY. It ensures that no family faces financial hardship due to health care needs. We vision an India where health insurance encompasses 100% of residents for all tests and treatments with major surgeries, chronic illnesses, and treatable cancers funded by the government tertiary health care system. So with this vision, the health insurance, both in center and the state, we are implementing this insurance, health insurance. Under Cmhis general category and Ab-Pmjay, which insured 5 lakhs rupees to the beneficiaries. Out of within these categories, we have treated 1,35,900 patients, amounting to more than 251 crores. And under Cmhis employees and pensioners, we have treated 57,556 patients, amounting to more than 226 CR. Here, the insurance risks benefit coverage for government employees and pensioners. The total sum insured is 20 lakhs for employees and pensioners per annum on the family floater basis. The sum insured shall be available to any or all members of the family for one or more claims during each policy covered period. The beneficiary under Cmhis employees and pensioners category shall be entitled to cashless treatment for both surgical, medical procedures and limited day care packages similar to that of Cmhis. All previous condition diseases are covered. Outpatient diagnostic services, standalone diagnostic investigations are not covered.
So we have two schemes, the Ab-Pmjay and we have the Cmhis, and they are under one card. It looks the same. All right, we call it the co-branded card. Co-branded card. So this is the three categories of eligibility: the employees and pensioners, the general category, and the NFSA group, which is the Ab-Pmjay, Ayushman Bharat, Prime Minister's Ayushman Yojana. Okay. So the GC is the category that comes in for your context. It will be for the group that is the indigenous inhabitants of the state who don't fall under either the first category or the third category. So we have one card and it's a cashless treatment. This is where we are, the scheme is very different from the previous schemes in that earlier, especially for the state government employees, we had something called the medical reimbursement policy, where the government employee would have to incur their health expenditure and then thereafter take it up with the government to get it reimbursed. Okay, but now the idea is that, and to start a cashless service. And insurance, I think you are aware, it's a relatively new concept in our state. So this scheme is having a double challenge, quite frankly, of not just implementing it, but also educating people on what is insurance and the terms of it. So these are the two, these are some of the areas that we need to sort of also remember when we are going through this presentation. So yes, so we have, again, the three groups. For the employees, we have the 20 lakh group. And then for the pensioners, also 20 lakhs. But like we have mentioned earlier during the question session, that pensioners don't get medical reimbursement. For government employees, it's practically an unlimited budget. If you finish your 20 lakh wallet in a year, beyond that you can always claim reimbursement. But again, this is not about your benefits, but about your eligibility. So how do you get eligible as a government employee for the 20 lakhs? It is on the basis of PIMS, the Personal Information Management System number. So each and every government employee, if you're a regular employee or contractual under the PSUs, under the commissions and the boards, all of them are supposed to have a PIMS number. And based on that PIMS number, they can apply for registration under the Cmhis EP category. So now who is eligible? The regular government employees, the serving legislators, only serving legislators, not retired persons, okay? Then the pensioners and ex-legislators, they come under a separate group, and then we have the common condition that they must be entitled to a monthly medical allowance. So pensioners and regular employees and some certain categories of non-regular employees, such as the work charge and casual employees who are getting scale pay. Okay, so they also get a monthly allowance, a monthly medical allowance, which is a little less than what the regular employees get, but they are also entitled to it. So a part, 50% of theirs as well has also been converted towards this scheme. So all of these four groups are eligible for the 20 lakh coverage. So who is eligible under the general category? For the journalists here, this is the majority of you will be falling under this category. So for you, there will be the indigenous inhabitants who are not covered elsewhere, like if you're not in the EP group or in the NFSA group. Then we have the contractual ad hoc work charge employees. They come under the general group, but the dispensation that they have is that they can register on the basis of their PIMS number, because they already have that. So beyond the PIMS number, they don't really need to give any other documentation. Okay. Then the ineligible EP dependents, like I said, the ones that I just described to you, the children who have grown out of your household or things like that, they would come under this group. And also your group, the accredited journalists. So the documents that you need, I think you must be well aware that you need your IPR ID card, your Aadhaar, your mobile number, etc. Basis on that, and the eligibility criteria is the same. Would be going within the next step. Yes. So then comes the Ab-Pmjay. Like I mentioned earlier, this is a very simple group. You are having your ration card, and on the basis of that ration card, you just go apply for get your card, to generate your card, and you get it. It's very simple. So currently, we have about 3.45 lakh NFSA households in the state, and the government has allotted 2.59, 2,59,468 for the state. So we have a little bit more, in fact, quite a bit more NFSC households in the state than is being paid for by the government of India.
I have a few questions. So you've mentioned about the number of cars that have been generated under the Cmhis. If I noted it correctly, it is about 2,12,567 cars that have been, that's for the Cmhis card, if I'm not mistaken, sir. Sir, if you can once again provide the data on how many cards have been generated, and under those cards that have been generated, how many beneficiaries have actually claimed. And I wanted to know the statistics of the hospitals that have made the most claims. Hospitals, if you can provide that of the private and public hospitals, also hospitals within the state and outside the state, sir.
So we don't have the data exactly ready with us. We can give it to you after the session, the number of individuals who have benefited under both PMJY and Cmhis. Similarly, whatever data points that you have requested, for example, the number of hospitals, how many benefits have been availed in every hospital, those we have, but it's with our data analyst. We don't have it ready right now. So we'll share it with you after the session. If you can just give your name and number, or if everyone wants, we can just send it to you across to all of you, the data points that you have requested. So the registration is an ongoing process. It's a very dynamic process because there are many general categories who do become employees. So there's a lot of deactivation under the general category and moving on to the employee part. And there are some who are employees and they are non-pensionable, so they revert back to the general category. So we have an ongoing process. Even now, currently, we have our district teams going on registration drives in all the schools. You must have seen the 100 days Ayushman drive in schools for students also. So that is an ongoing process. So this will keep increasing and keep changing.
Well, can you tell us, what are the disease and treatments that falls under this scheme? Because recently I've mentioned one kidney stone patient, and she was telling me about the problems that she faced, and that very hospital is also already empaneled with the both the schemes. And she was saying that despite she being treated in that very hospital, she did not, they denied the benefits. They said that this very card cannot be used for this kidney stone treatment and even for the operation. So can you highlight more on that, please?
And Cmhis, we cover all disease, all treatment, as long as it's a hospitalized care. So we have the conservative treatment where there is no surgical intervention required there. As long as the patient is hospitalized, we cover all of that. However, nationally, immunotherapy is not covered. So that is not available to general category or PMJY beneficiaries. Otherwise, most other treatment is covered. So we have listed health benefit package, but it's not possible to exhaustively list all disease, all procedures. So we have an open procedure code called an unspecified procedure. So even if the treatment is not listed also, hospitals can book it under the unspecified package to avail the services. As long as they have a valid registration certificate under the establishment, healthcare establishment under the Department of Health and Family Welfare. So within Nagaland, as long as it's a valid certificate holding hospital, we empanel all of them, provided they provide inpatient facility. So there might be some clinics that do not provide inpatient facility, those we do not empanel. So as long as they have inpatient service, we empanel. However, outside the state, especially for employees and pensioners, we have more strict criteria. We empanel only hospitals that have NABH certificate or JCI certification. That is to ensure we empanel only quality hospitals. Our team cannot go and check the quality outside the state. So we depend on the third-party certification like NABH and JCI to ensure that we empanel only quality hospitals. and they should also show some footfall from patients from Nagaland in their hospital. So those are the criteria, two different criteria within Nagaland. As long as they are a valid inpatient providing hospital, we empanel them, and outside of Nagaland, we empanel NHPS or JCI certified hospitals which have some proven footfall from patients from Nagaland.
And how can the patients identify which hospitals are identified as empaneled?
Yeah, so we have a website, cmhis.nagaland.gov.in, where we list all the empaneled hospitals. So we have categorized it state-wise. So for Cmhis EP, we have listed every single hospital that is empaneled with us statewide. However, for a general category, we are using the PMJY national network of hospitals empaneled under PMJY. So there are like around 30,000 plus hospitals. So that we are not able to exhaustively list in our website, but we have given the link where people can check if there are 5 lakh cardholder. They can check in the PMJY website which hospitals are empaneled under PMJY. Our website where you can go state by state and see which hospitals are empaneled under the scheme. Again, the website is one. Many people are not accessible to the website also. So we have our toll-free number with active agents who can assist anyone who wants to know whether a hospital is empaneled or not, whether service is available in any of the hospitals.
A couple, 1-2 years ago, there have been some cases in Dimapur especially, some hospitals which display PMJY, Ayushman and hospitals outside big ports. So seeing that many patients have gone to these hospitals, or maybe the website details which you just mentioned, people see those big billboards or banners and they get into hospitals. But in that period, maybe for some few months, and not naming those hospitals had some issues maybe with the department or the government. They were unable to reimburse, including my father. My father was admitted to a private hospital, empaneled hospital in Dimapur, but he could not get reimbursed, lakhs of rupees. Similarly, there were many cases among my friends and family, many local people which we have interviewed. Now, they did not get the reimbursement because maybe for a few months or some issues were going on. But the time has passed, they had a health card, and the hospitals were empaneled. Those same very patients, will they get their money back? No, the time has passed, and I'm talking about lakhs and lakhs of money. Yeah, maybe they had some issue for a short duration, but it's their hard-earned money. So how do they get it back now?
Private hospitals had actually decided to move out of the scheme, even though they have come back again now. So during that period, because we did have that specific issue where they terminated the contract, we had issued a public notification also to everyone to please, these hospitals are no longer providing the services under the scheme, and to go to any of the public empaneled hospitals, including CIHS. Because if the hospital is not providing services and they have terminated the contract, there is we cannot force the hospital to provide cashless service. That is why we had issued a public notice also to please visit the government hospitals for any emergency treatment during that period.
That I understand, but there are people now. People are poor, people are uneducated. But those hospitals were proudly displaying big banners and seeing those people get into those hospitals. Maybe they're not following some detailed notifications in a website, but they just get in and they have lost their money. Can they claim it?
But I think the hospital would have said the services are not available under the scheme, right, when they went for treatment. Because generally the initiation of the coverage starts from the moment they are admitted, right?
As far as I've talked to many people on the field, it is only after they have done the treatment the hospital tells them that.
No, in our insurance, generally the coverage, the moment you are being admitted for any treatment, the hospital has to raise a pre-authorization request to the insurance company. So before the commencement of the treatment itself, the hospital would have informed that the coverage is not provided for the scheme.
Is the issue with the insurance company and the Department of Hospitals, when is that settled? Because last year I also had a surgery where the private nursing home here in Pune itself displayed all the schemes, all the availability, but the doctor said that there are issues going on, so we cannot take any card now. So where has this issue, the problem between these three companies, the hospitals and the department, been settled? When that happened?
So we had a period from I think about 3 months when the private hospitals had pulled out of the scheme, but they have most of them have, I think 90% of the private hospitals, they have come back under the scheme by July 2025.
So it has been an issue publicly, right?
Yes. As of now, that issue is not there for most private hospitals. There are still a few private hospitals who are in the process of re-empaneling that. So that's a different thing. But in general, most of the private hospitals have come back under the scheme.
In regard to Cmhis, the first question is, the Cmhis provides different room entitlements based on the employee's pay level. Does this room entitlement apply equally when a beneficiary chooses to undergo treatment at an impaneled private hospital, or is it applicable only in government hospitals? If the entitled room category is unavailable at a private impaneled hospital, how is the beneficiary accommodated, and how is the difference in room charges handled?
So this is applicable for both private hospitals and public hospitals. For employees and pensioners only. General and PMJY category, they are entitled only for general ward category. So if you go to any hospital, based on their pay level, they can access private room, semi-private or general ward. We are following CGHS guidelines for this room entitlement as per pay level. So this is exactly as per the central government guidelines for central government employees. So if a room category is not available, currently even the central government doesn't have any specific guideline on how that is supposed to be accommodated. So we also currently do not have a very specific criteria or guideline on if a room category is not available, how to cover that one. But generally, as of now, we have not faced any complaints or grievance that a room category is not available, so that they are not being accommodated. So we have not had any issue of service being denied because of room category not being available.
This is also regarding Cmhis issue, and this issue has been like widespread last month, even in many social media, where government employee alleged that newborns NICU treatment costs about 6.79 lakh, but Cmhis EP covered only 1.63 lakh, leaving him to pay about around 5.15 lakh. So what is the current status about this issue?
So this was an issue where the hospital had not raised the claim in the system. So this one, we had spoken with the hospital also and asked them to raise the claim in the system. Again, ideally we would prefer if patients immediately let us know, because this was a case where the hospital operator, for whatever reason, did not raise the claim in the system and did not provide the service. Ideally, if the patient had called us first, we could have checked what is the issue and told the hospital to immediately raise the claim, and all this could have been avoided ideally. But they made a payment and then went out in the media. That's another thing. But this has already been cleared. We have spoken with the hospital and had them raise the issue in the claim in the system. Yeah.
So somebody who might have applied for the Cmhis card and has it, but wants to go for treatment outside and does not have PMJAY card, so can they have both cards meet, or?
No, we cannot have both cards because one person cannot avail under two schemes, right, for a similar health issue. So this movement from one scheme to another is not allowed. We need to understand that we are paying an insurance company premium. So for every household, we are paying PMJY separate premium and Cmhis a different premium. If we allow all this movement, our number of households will double because people will keep changing their scheme, right, depending on where they want to go. So we do not allow, especially for a government employer or pensioner, to go back to Cmhis general category or PMJY just because they want to visit a certain hospital. We have ensured that hospitals out within Nagaland, if a hospital wants to empanel for Cmhis EP, we make sure that they also empanel for PMJY. No hospital can empanel only for one scheme. Outside of Nagaland, we have ensured that all hospitals with tertiary care is empaneled. So it is very unlikely that they will find a hospital that only a PMJY empaneled hospital provides. Again, the numbers can be a little misleading. Even though it is 30,000 plus hospitals under PMJY, PMJY is a welfare scheme, so the package rates are quite low compared to our state scheme of Cmhis. So many corporate hospitals have refused to empanel under PMJY. Now under PMJY, it's a national scheme, so they empanel under their respective state, not with Nagaland. So we cannot force a hospital to empanel under PMJY because they have to empanel with their state government only. So this 30,000 consists of all public hospitals, and of course many secondary care hospitals are there, but most of the bigger tertiary corporate hospitals, like if I can just name like Fortis, BLK, Max Hospitals, Medanta, all these are not empaneled under PMJY. So it's very unlikely that an employer or pensioner will find that, a service not empaneled in any of these EP hospitals are only available in PMJY hospitals. So the whole idea is to provide the financial protection by reducing out-of-pocket expenditure for people going for treatment. The next one, access. So generally, before the launch of the health insurance scheme, when you need cash in hand for going for treatment, those people who don't have financial means would generally go to a public hospital, right? Because there the cost of treatment is much less. So the government wanted to democratize access to hospitals by bringing in both public and private hospitals into its empaneled network of hospitals. And anyone can go to any of the private hospital or public hospitals, irrespective of whether they have money at hand for going for treatment. So this is democratizing access to healthcare to everyone, and also efficiency. So we had different schemes like PMJY, RSBY. We have other schemes for BPL families, and also we had the medical reimbursement for government employees. And pensioners actually did not have any kind of medical cover. So all this has been brought together into a single scheme which is converged together as Ab-Pmjay and Cmhis. One of the things that you will find with the specific PMJY and Cmhis, the reimbursement to hospitals for providing cashless treatment is on the basis of a package. Now, if you have a private health insurance, a retail health insurance cover, it depends on the insurance product. Some insurance companies will provide treatment as per line billing, depending on how much has been utilized by the patient. So there are different insurance products, but as a public health insurance scheme, at the central level and also at the state level, whenever hospitals are reimbursed for providing a treatment, cashless treatment to a beneficiary, they are reimbursed on the basis of a package. So if you go for a procedure like, let's say, an appendectomy, all hospitals will have the same rate for providing the appendectomy treatment. So irrespective of whether it's a public hospital or a private hospital, there is a government approved rate for every single procedure, and that is what we call a package. So under PMJY and Cmhis, the central government has listed about 1,950 procedures, and they have given the rate for each procedure based on which the hospitals are supposed to be reimbursed. Again, this is an indicative list because if you go for a surgery which is not in this list, we have an open package through which hospitals can still claim for reimbursement for providing cashless treatment. These package rates, when we call a package rate, these are bundled package. So So if you are going again, coming back to an appendectomy procedure, so the nursing charges, the room charges, if ICU is required, that will be separate. However, OT charges, doctor consultation charges, medicine charges, all these are bundled together as a single package, and hospitals are not supposed to charge patients anything beyond the bundle package. So the bundle package also, hospital will not be recovering that from the patient. They will provide cashless treatment and they will release a claim with the insurance company for getting paid, reimbursed for the cashless service that they provide. Pay level for employees and pensioners depending on the pay level of the employee or the pay level at which the pensioner retired. They will have access to general ward, semi-private room or private room only for employees and pensioners. For general category and PMJY, they have access only to general ward.